If you hate anyone touching you like this, on the head or anywhere else, there's some pretty cool neuroscience that might explain why and suggest some practical alternatives. This is What the Science, Tingles and Touch, Episode 2. Last time, we covered how you have specific types of nerves called CT fibers that are sensitive to this type of slow, tingly touch, and how doing it can both boost oxytocin levels and make it feel better when your oxytocin levels are higher. Around 70% of you said that you'd prefer 1 minute of chills to 1 minute of gentle massage. But there were a whole bunch of you in the comments who said that you hate anyone touching you like this. So if you've ever wondered why that is, or needed to explain it to a friend or loved one, grab your science hats and buckle in. Imagine your nervous system as a postal service. First, you have millions of tiny post offices in your skin called nerve endings. These sort incoming touch into different categories. CT mailboxes handle slow, gentle strokes as friend mail. Another type processes firm pressure as info mail. And pain mailboxes stamp emergency on anything sharp or hot. All of these messages then travel to your regional sorting hub, your spine, where they're scanned and sent on to different neural highways headed towards your brain. Once there, it goes through several departments. The sorting desk decides what the touch is. The reward office decides how much we like it, and the threat office sounds the alarm if anything looks risky. When this whole system works perfectly, a gentle stroke arrives with a smiley face stamp. Pure tingly pleasure. And that's how it usually goes for neurotypical folks. But here are 5 ways it can go wrong. For those on the autism spectrum, the staff in their brain never got the full basic training. Friend mail often ends up in an unknown pile, and sometimes in an emergency one, making the light touch feel irritating and sometimes painful. With ADHD, the regional and central hubs are noisy and disorganized. The friend mail and info mail get easily mixed up, and the brain ends up shouting, "Too much mail, stop!"
Every day it piles up more and more and more, and you gotta get it out, and the more you get out, the more it keeps coming in.
With chronic pain or fibromyalgia, the regional spinal sorting center operator is colorblind and can't tell the difference between those green and red letters. And the light green touches end up getting sorted into that red pain highway. Ouch. With depression, all the staff in the brain's reward office goes on strike. So even correctly delivered friend mail gets no feel-good reaction. And with high social anxiety or trauma, the security team in the central office is all jumpy. So any unexpected letters, even friend mail, triggers an alarm. But all is not lost. If you're in one of these categories, here are some ways for you to work within the wonky system to still bond with your partner, boosting that oxytocin production. 1. Choose heavier packages. Use firm pressure like big hugs, weighted blanket, or use yourself as a blanket, or a deep pressure massage. These ride the info mail route, bypassing those glitchy CT channels. 2. Give clear tracking numbers. Verbally signal when and where touch will happen. Predictability quiets those security officers. 3. Set your environment. Warmth, dim light, and low noise keep that whole sorting office calm so nothing gets put in the wrong place. 4. Skip the post office entirely. There are many ways to boost oxytocin and bonding with your partner that don't involve touch at all. We'll cover those next.